Hello, my name is Dennis Katzeliadis. I'm the current president of the Hellenic Medical Society of Philadelphia. Today we're making a first YouTube video of a series that we're trying to start where we will have our members speak to you about why they are members of the society and what their specialty is and how they started their career and where they are right now. We hope you will find the segment interesting.
Can you tell me what is the Hellenic Medical Society?
The Hellenic Medical Society of Philadelphia is a non-profit organization that was started a few years ago with the goal of bringing together physicians and other healthcare professionals of Hellenic descent or of some other Hellenic connection in order to provide fellowship among them, to get them together, to have them be collaborative and be collaborative with other societies. Promote scholarship. This is done via educational events and provide a scholarship for young students that are aspiring for careers in the healthcare professions. And finally, to promote community service with providing lectures, information, sometimes blood pressure screening and other events to the community at large, especially the Hellenic community.
Why did you join the Hellenic Medical Society?
I think all those goals are important. I think it's important to connect with people that have similar experiences, that come from similar backgrounds, and it's a way for me to be involved in my community and help younger students out, help patients out when we can. That is why I'm a member.
What is the mission of the society?
It's the three pillars that I talked to you about. It's to promote fellowship, community service and scholarship.
Tell us a little bit about your career.
So I actually was born in Canada, but I grew up in Greece. You can tell that from my accent at this point. I came to North America after I finished high school, back to Canada where I finished medical school, and then I have completed training in internal medicine. After finishing my medical degree at the University of Toronto, I completed training at the Mayo Clinic in internal medicine. Then I did a pulmonary and critical care fellowship. That means I'm a doctor for lungs and critically ill people at Duke University. After that, I went back to the University of Toronto, where I did an advanced fellowship in managing patients with lung transplantation before and after, and also managing patients that have cystic fibrosis. After my advanced fellowship there, I stayed on faculty for a couple of years at the University of Toronto, and for the last 9 years I have been at the University of Pennsylvania, where currently I'm the director of the Adult Cystic Fibrosis Program and a member of the Lung Transplantation Program.
So what do you do currently?
Okay. So I'm a physician who mainly treats patients. I am involved in some research, trying to bring new medications into clinical practice, but mainly I spend my time taking care of patients. I deal with the patients that have a genetic disease that's called cystic fibrosis. This is common in people of European descent. It's a little more common in Northern Europeans, but it's also relatively common in people of Hellenic descent, Greek descent. And it's a genetic disease. That means that it's something that you're born with that affects a little channel that makes chloride, which is a little ion that moves around. And when it's dysfunctional, when it doesn't work very well, it makes secretions very thick. And as a result, these patients have usually difficult lung infections, thick mucus in the lungs, trouble gaining weight and eating appropriately, and at a young age they can also develop diabetes. Most of these patients die on a young age. They used to die as kids. Now, most of them make it to adults, but they still require chronic care, and the life expectancy is still limited. It's probably around 40 years of age right now. So I'm a physician that deals with these patients and trying to help them manage their disease and get better and stay well and not sick. I also treat patients that need lung transplantation, patients with cystic fibrosis and other diseases. Those are people that have very advanced lung disease and their lungs are not working at all, and we'll try to find out if it's safe and appropriate for them to try a lung transplant and see if we can give them better quality of life and longer life. That's my other part of this. Finally, I also treat patients that have a disease that's called bronchiectasis, which means it's a disease that scars the lung and creates a lot of infection. Again, trying to help them out in doing things better. I do research in those entities, trying to bring new medications into practice and find out more about the specific diseases.
What do you like to do when you're not working?
Well, I like to spend time with my family. You can see my daughter that showed up, here.
I'm the cutest and only daughter.
She's not my only daughter, but she's trying to basically not talk about her younger sister. We like to
I am
travel.
the cutest.
So, go now. So, we travel a lot, almost every year. We go to Greece, but we go to other places too. I like to read, especially history. I like to also, watch, sports. I'm a big soccer fan, so other people know that. And of course, I spend a lot of my time volunteering in things like the Hellenic Medical Society.